Our next speaker is Anthony Day from IBM, and I don't know, Lorraine, if you want to say a few words before Anthony speaks.
Hi there. Yeah, just the OPS, our public service, and DEEPR are looking at blockchain in the wider public service. And I just wanted to bring on something about blockchain so that people within our health service might start looking at it and thinking of ways that we could use it, that it could benefit the health service. So I'm delighted that Anthony could turn up today and present for us.
Great.
Good. Thank you very much for the kind introduction, Lorraine and Martin. My apologies if my background looks like I'm on a bed. I am on a bed. It's not that standards have slipped during COVID-19. It's that actually the HSE very kindly managed to fix my ankle not long ago. So I've 3 weeks after ankle surgery. So thank you very much to all of the practitioners and the kind support that I've had in my my surgery and rehab so far. I'm going to talk about blockchain technology in the context of the current pandemic and some of the other broader work that IBM's been doing in this space. The simplest way to think about blockchain technology is it's a way of sharing data between multiple parties. So when you think about healthcare data, or when you think about identity, or the more recent topic of healthcare certificates, digitization and verification of health certificates relating to vaccines or COVID tests or whatever it might be, this is a technology that works particularly well in this context because it supports privacy, it supports anonymity, it supports encryption, and it's easy for multiple different organizations to connect into. So whether that's with existing systems, whether that's through cloud, whether that's public, private providers, private testing companies, the HSE and others, it's a system that scales quite well also. So I'm going to try and illustrate that with a few examples. I noticed that Professor Blomgren has also left, but my favorite digital transformation analogy, if it's of any use to anybody else, is that sliced bread was not, the person who invented sliced bread neither invented slicing nor bread. So the opportunity for us to transform with the assets that others have developed and to stand on the shoulders of giants is there for all of us. So just wanted to share that one before I started. So I'm going to put some slides up here. I know I've only got 15 minutes or so, so I'm going to canter through relatively quickly. But some recent examples of our use of blockchain technology, or the work that we've been supporting around the world. In a couple of more recent examples, IBM Digital Health Pass and our work in terms of self-sovereign identity management and healthcare data management is going on within New York State and also for the German government in terms of supporting their rollout of the health credentials and verification in their jurisdictions. We're doing a lot of work in the supply chain space around drug traceability. It's a multi-party ecosystem. It involves a number of different manufacturers, logistics companies, distributors, pharmacies, hospitals, and the ability to be able to link up that data end to end is critically challenging. And specifically when it comes to approvals, recalls, there's a long lead time, and oftentimes in terms of being able to bring that data back. So the technology works very well there. We're also partnered up with Moderna, looking at the vaccine supply chain, also particular challenges around cold chain and being able to keep product at certain temperature. So data and the visibility and integrity of data is critically important there. We've also got a number of ecosystem partnerships going on, working with a number of the other digital wallet providers, payments providers, and charities and philanthropic organizations around developing standards for digital health passes worldwide, and also around our collaborations in a number of jurisdictions with testing providers to help scale out proactive testing capability to take pressure off the national systems, to embed it more easily and more cost effectively into return to work or return to entertainment type scenarios where we know the private sector can help scale up and take pressure off the national system. So hopefully a few examples there very quickly that might be of use. Very happy to connect offline or go into more detail on some of these. There's an awful lot of publicly available information on there too. So in short, every business at this point is now a healthcare business, whether we like it or not. The pandemic has taught us that we now have a challenge in terms of global management of healthcare credentials, right? 8 billion people in a number of different settings, whether that's travel, whether that's work, whether that's immigration, whether that's going back to sporting events, music, concerts, theater. At some point over the next 12 months and beyond, if we haven't already, we are going to be asked whether we've been vaccinated, we're going to be asked whether we've been tested, and we're also going to be asked to prove that with some form of credential. And there are a number of different ways that that's being orchestrated, some very simple ways, And this is a complex domain. First and foremost, this is something that involves policy, epidemiology, technology, and also a degree of public and private partnership also. So anything that we look at in this space around health credential management has to be proportionate, has to involve policy, has to be inclusive, has to be accessible. Not everybody has a smartphone. Not every country has accessibility to data and roaming. It's not going to work 100% digital, 100% smart, 100% of the time. But there are examples out there in the world when, if you look at, for example, airlines or travel, in most airports that are still operating today, you're seeing something like 90% of the staffing for about 30% of the passenger load or less. And the reason being is that those passengers are being asked to provide something like 5 different forms of documentation in physical format today to verify that they're safe to fly. Their passport, their boarding pass, their proof of accommodation at the other side, their proof of vaccination or test results, and also any number of specific forms for immigration on either side. And that's being done mostly manually today. And that's at about 90% of staff capacity. If we move up to 50% of flights or 80% of flights and passengers going through the airports, that system's going to break very quickly. We're going to end up with long queues, multiple hours of people waiting in airports. That's both a negative customer experience. That's also not particularly safe, common practice in the middle of a pandemic, having lots of people standing around waiting for things to happen. So in most cases, the consensus is we need to reach some degree of digitization to be able to support this. And with digitization comes the question of identity management, the challenge of how do we embed this within the existing experiences, because we don't want to have passengers with hundreds of thousands of apps or citizens with lots and lots of different capabilities. Data privacy, surveillance, and the ability for individuals to maintain sovereignty over their own data is critically important. Proportionality also is a really important part of this, insofar as we don't necessarily want to have to show our credentials to be able to go to the pub or the restaurants. We want to go back to normal life as much as possible, so where it doesn't belong or where it's not necessary, it shouldn't be used as we see it today. We took some survey data. This one was sort of middle of last year, is employers and employees. Something like 65% of employees were looking at testing being something that will become normal practice for them to return to work. If you take some more recent data, 80% of large employers are looking at awareness campaigns around vaccines, and 55% of those employers are evaluating whether they want to offer incentives around staff getting vaccinated. Now, let's be clear, not everybody is going to volunteer to be vaccinated. We don't want to see mandatory vaccination policies. But these are some of the considerations that employers are looking at, or the private sector is looking at, in terms of how do we get the economic recovery going? How do we get people back into stores, back into restaurants? How do we get normal working practices? How do we get productivity up for those organizations where it's more difficult to socially distance, or where their work can't be done remotely, or where, frankly, they don't want work to be done remotely and they prefer a face-to-face or customer-centric model? So these are some of the challenges. And we've been working with health credentials, digitization of health credentials for a very long time. Prior to the pandemic, a number of the digital capabilities we've been working on with hospitals, with governments, with national healthcare providers, has been put into IBM Digital Health Pass as a concept. I don't want to spend a lot of time shilling the tech, because that's not really my point today. What I'm more interested in doing is help raise awareness for what comes next. So there's going to be a degree of applications around this. There's always going to be a credential that I want to hold as a citizen. I'd like it to be on my phone because that's more convenient to me, but it could be held in paper form. It could be held in a number of different models. And there's going to be a requirement for verification. So when I'm booking my ticket, when I'm appearing somewhere in person, there's an ability to verify. And in all of those cases, I don't want information that's private to me to be shared with anyone else without my permission. I don't want it to be shared at all if it's not necessary. And I want to have the underlying platform, the systems, the technology, talk to the places where I want to go. So the integration with airports, airlines, trains, ferries, whether that be theatres, football matches. How do we manage to get that verification embedded in a digital way, in a relatively seamless way, as much as possible, such that I can go about my daily business without too much challenge, and also without employers or companies or the verifiers holding my data where they shouldn't have to. We don't want them to be holding personal health data, and neither do you. So a big part of this is, how do I, as a citizen, obtain a credential that I can use, that's convenient for me to use, that I don't lose in the way I might lose a piece of paper, that I don't have to constantly download from a website every time I want to go anywhere, where there's a low risk of fraud, where I trust that that system, because of the way it's orchestrated or because of the user experience, works well, and that can scale. and that's easy to manage. There are going to be paper-based models, but when you print off a PDF document, when you have a QR code in the top right-hand corner, when you scan it, all you're going to return is that the information I receive relative to this QR code is as I expected. It might not tell you that this credential is active. It might not tell you that it's been revoked or not. It won't tell you that the identity of those who issued this credential are recognized to the system. All it will tell you is that this QR code is what it says it is. And that presents a number of different challenges around fraud or the scalability or passing documents from one to another. There's a few benefits with digital-based systems that will help us to make the journeys more seamless, reduce fraud, and also make sure that we obfuscate personal information as much as possible. So all we do is return green, red, or that we return okay to fly, instead of being able to have to show a secondary document like a driver's license or a passport to get into a pub, where I don't want them to know my date of birth. I don't want them to know my address. I don't want them to know I've been vaccinated. I just want them to know that I'm safe to enter. And that's a critically important part around the user experience, where I don't think a lot of that's been covered so far. I was going to show a video here, but I think in the interest of time, I probably won't. I've already been at this for 8 minutes, and I know the guys want to get on. So what I will say is, in all of these different settings, there are 3 key parties to think about. There's the individual, the person holding the credential, and their experience. How do they access the information? How do they download it? How do they show it? How do they store it? What happens if they lose their phone? Can they recover it? There's the issuers of credentials. That could be the HSE. Those could be testing centers. That could be boots on the high street. That could be any number of different parties who are able to issue a credential. And we need to make sure that we trust who that is, that they are able to issue credentials, that they are able to be onboarded onto a network where anybody who issues a credential is trusted and known. It's KYC for health credentials management, essentially. And then from a verifier perspective, this could be anybody. As we talked about the use cases, it's about return to work, school, travel. This could be universities, it could be airlines, it could be train lines, it could be hire car companies, it could be, as I said, cafes and bars. But as much as possible, we don't want to see the invasiveness of health credentials. If we're seeing already appropriate social distancing in restaurants, let's try and keep the technology out of places where we want to see normal life as much as possible. So these are the parties involved. And over the next few months, by summertime, we're going to see a mix of a number of different solutions here. We're going to see private sector solutions from a number of different jurisdictions. You've heard the likes of Common Pass, IBM's Digital Health Pass, Accredify, Clear, AOK, all operating in different jurisdictions, all to some extent working on similar principles and similar technology models. And there's a lot of work going on in the background to be able to integrate and to interoperate those solutions. And I'll tell you more about that in a moment. You're going to see some industry-specific solutions. IATA specifically for the travel industry, Amadeus in there as well. You might see some sporting specific or sports authority sponsored solutions that might have some of the private solutions in the background, might be homegrown. And those might be particularly appropriate for an individual context where they're providing the testing, the technology, and they're integrating that into a fully end-to-end experience. And you're seeing the government solutions starting to emerge as well. So a number of national governments are stating that they have health pass technology, that they're looking to roll it out in various different forms. You've seen the EU Digital Green Certificate announcement as of last week. There are going to be government standards that are going to need to interoperate. What is critically important to remember is that it's not going to be one health pass to rule them all. As you think about this domain, think that what we want to have is the ability for businesses, for travel, for places of education and employment, to be able to accept and receive multiple different types of these credentials, for you to be able to verify yourself without passing personal information where it's possible, that is proportionate, that embeds and that fits into existing journeys already, that is inclusive. So there are a number of journeys for those who are digitally enabled with smartphones. There are those journeys available for those who don't. And also that works hand in hand with policy and epidemiology. And this is the critical area that we as IBM have been working over the last 12 months, that we continue to work with a number of these stakeholders, and that we believe in Ireland can be, where it is proportionate and appropriate, an enabler for a number of the different businesses, whether it be the US to Ireland travel and business corridor, whether that be relating to the UK and Ireland travel and business corridor. There's a number of different settings where we believe integrating interoperable health credential management into existing systems in a secure and privacy preserving way is going to help us to accelerate the economic recovery and accelerate us back to normal life. It's going to take some time, but most people underappreciate the complexity and the integration challenge of what's coming. And we believe we need to be on the front foot on that particular journey. That's all I have for you guys today. Open to questions. If you want to reach out to me, it's anthony.day@ibm.com. Feel free to connect with me on LinkedIn. I'm regularly posting kind of the updates that I can share around this particular topic and more content on blockchain as well. Thank you very much for listening.
Thanks, Anthony. Really good talk, and we look forward to, you know, the HSE and IBM Ireland in particular exploring some joint possibilities and opportunities here. So great, thank you.